Hi, friends. We are live now. I am Yolanda Harper, co-founder of Harper Therapy. I'm here today with Chris Long, licensed clinical social worker. And Chris, I'm just going to take a breath because this is a different topic. You know, it's a pretty heavy topic, and we are bringing this conversation to the forefront today because it's kind of what we do. We're kind of in the business of having the hard conversations because they're the important and the necessary conversations to have. So the topic today of suicide is not to be alarmist or extreme or anything like that. It is a simple fact of we know statistically that a lot of the things that are happening in our world today are kind of coalescing together to increase the likelihood of people feeling hopeless. And we know statistically that suicide rates increase when people are isolating, when people are not coming into contact with their support system, when there's been job loss and such. So we're here to talk today about what to look out for in ourselves and in our loved ones and in our community as far as suicide goes and what actions to take, right?
Absolutely, absolutely. And Yolanda, you made a really, really good point there because when we face a situation like we're facing now, okay, the stress level is raised for everyone, okay? And I like to kind of look at that impact on the at-risk populations. And when I say at-risk populations, okay, we know senior citizens, okay? We know right now they're even more isolated, more likely to be impacted by health problems, okay? And suicide rates always increase, okay, in those populations. People with prior mental health or even physical health histories, okay?
Right.
The rates go up. Drug and alcohol users and people with addictions. Look, social distancing and some of the restrictions really impacts them in profound ways, okay? Because now they may not have access to some of those coping mechanisms, okay? Healthy or not, okay? But it's really, really important and it's real, okay? Because the exacerbating factors, as you said, are there. People are losing their jobs. Their status is changing, okay? There's a loss of control, okay? I don't know what's happening, don't know what's going to happen. It's uncertain. That scares me, okay?
Yeah, and there doesn't seem to be an end in sight. There doesn't seem to be an end in sight, so it feels more hopeless.
Absolutely. Hey,
Yeah.
even look at lifestyle changes,
Mhm.
family structures, and disappointments, okay? Now, I don't want to exaggerate it, okay? But even look at some of our teens right now, okay?
Mhm.
They were planning on prom, they were planning on graduation, maybe they were depending on their sports season for a scholarship, okay?
Mhm.
There's a lot of things there that can actually lead to some of those feelings of distress, okay? And hopelessness, okay?
Mhm.
And the isolation, okay?
Mhm.
And even the media consumption can exacerbate
Yeah.
that. There is
And
so much
again,
information out there right now, lots of it.
yeah, a lot of it. Yeah, and again, this is not to be alarmist. This is what we know statistically. Let's just pay attention to what's going on.
That's
Right.
right. That's right. Okay. And one of the things that I just want to kind of create is a little bit of awareness of some of the signs. Okay. And I
Mhm.
keep it really, really simple and straightforward. Okay. Um, Listen to what the people around you are saying, okay, and listen to how they say it, okay? Now, again, it's not your responsibility, okay, to assess and go from there, okay? But when people are acting in ways that are uncharacteristic, if they're normally very emotional and all of a sudden they're calm and indifferent, okay,
Mhm.
you know what? It may be time to ask the question, okay? If just the opposite, if they're normally calm, okay, cool and collected, and all of a sudden they're overly emotional, okay, it may be time to ask the question, okay? And when
Mhm.
I say it's time to ask the question, it's real, okay? Research
Mhm.
will tell you asking someone if they are going to commit suicide does not increase the probability, okay? As
Mhm.
a matter of fact, you should. And that's why I'm going to say, repeat after me. Are you thinking about committing suicide or killing yourself?
Yeah, and you know what? We were just talking before we came on live, like that question, even as professionals, that's uncomfortable for us to ask, right? That's just an uncomfortable question. Do you have plans to hurt yourself, right? Um, so that the uncomfortable part doesn't go away. We ask the question because we know it's necessary.
Right. Well, and think about it. I'm a professional. I do this for a living. I probably do it 10 to 12 times a week with different clients, and I still feel uncomfortable doing it. Okay.
Mhm.
But saying it, okay, does not increase the chances. Saying it increases the chances, okay, that you will connect with them, okay, and
Mhm.
that they will come clean or be honest with you, okay, because
Mhm.
most people, they don't want to hurt themselves. They don't want to kill themselves. They don't want to commit suicide. But right
Mhm.
now, it may seem like the only answer to them,
Right. Right.
okay?
Yeah.
But even the other thing too is I want you to also look at a couple of the multipliers, okay, in addition to the risk factors, okay? When people are drunk or high, okay, guess what?
Mhm.
They're more likely to injure. Okay, they're more likely to kill themselves. Okay, and sometimes it's by accident. Okay, that's one.
Mhm.
Number two, access to guns and weapons in the home. Okay, look, we're
Mhm.
Florida. We have lots of guns in our homes. Okay, it's
Mhm.
that simple. Okay, but you need to be conscious of it. Okay, and
Right.
the same thing with pills and medications.
Right.
Okay,
Right.
and they don't even have to be that person's pills or medication. Maybe grandma has painkillers in the cabinet, okay?
Right.
Something like that, okay? But those are all things to, at this point in time, honestly and truly be very, very wary of if you live with someone that you're concerned about.
Right. Yeah. And we know that people can use any kind of method, but we do know that they might, statistically speaking, it might be more of a use of pills or that kind of thing. But the guns are more lethal use.
Right, right.
Yeah.
And that's it. So just kind of like looping right back to that, okay? You have to ask the question. Are
Mhm.
you planning on killing yourself, okay, or
Mhm.
committing suicide? You have to be able to ask it, okay? It's actually a sign that you care. That's kind of one. After that, you got to be calm, okay? And it's so difficult when you ask that question to be
Right.
calm, okay? But be calm, listen, acknowledge, don't judge.
Mhm.
It's
Mhm.
not a time to negotiate. It's not a time to bargain. Okay.
Mhm.
You're not going to solve their problems and you're not going to change their mind. Okay. So don't
Mhm.
try. Be there, stay
Mhm.
with them.
Mhm.
Okay. Team up with a family member or friend and
Mhm.
get help. Okay.
It
This
helps.
is one of those things that you're better erring on the side of caution. Okay.
Right.
Because guess what? There's a lot of community resources that are really, really helpful. Okay.
Right.
Suicide prevention hotline, 1-800-SUICIDE, Tampa Bay Crisis Center 211. Okay. And if you don't know who or what to call, if you call 911, okay, they will put you through who you have to speak to. And there's no shame in that. No
Mhm.
shame at all.
No shame in saving a life.
That's right. That's right.
Yeah.
Um, it's also, and I just want to add one little caveat. This is not necessarily the time to call your therapist. Okay, and what I mean by that is yeah, we want to work with you. Yes, we can help. Okay, but
Yeah.
when it's a crisis, okay,
Mhm.
you need to call someone that can respond immediately. Okay,
Immediately.
and it's really important. Okay, because we may not be available. Okay, and guess what? We're also all affected by the situation as well, which
Mhm.
may impact our availability. Okay.
Mhm.
And I would tell a client or a family member to call 911 or 211 anyway. Okay. Because I want to make sure
Absolutely.
it's handled the right way. Okay. And handled as a crisis, which it is.
Yeah. Wow. For a heavy topic, these are some good tips, right? So talk about it. Don't, be aware that this situation is out there, be aware of risk factors. Don't be afraid to talk about it and know that there's help. Know that there are
Right.
resources that you can reach out to immediately to help. You're not in this alone. None of us are in this alone, right?
That's
That's
right.
why we wanted to have this conversation is to remind everyone like we are not in this alone and this is how we're going to be able to get through this and hopefully get through this safely,
That's
right?
that's talk about it, team up, call for help.
Awesome. Thank you so much, Chris, for helping us to have, this really difficult conversation, but really necessary conversation.
Stay home, stay safe.
All right, everyone, take care of yourselves and let's take care of each other.